In 1 month, the Trump administration is shutting down the National Crisis Hotline that has specialized services specifically for LGBTQ plus youth. That's according to this notice from SAMHSA, which is the Substance Abuse and Mental Health Services Administration. SAMHSA is part of the Health and Human Services Department and is overseen by Health and Human Services Secretary Robert Kennedy Jr. But why is this happening? Well, according to the notice, it's a money thing. The so-called Option 3 service is available through the 988 Crisis Hotline, which is a free, confidential government number you can call, text, or message 24/7, 365 if you are in crisis for a whole host of issues. If you are an LGBTQ plus youth in crisis, when you call 988, you are directed to press Option 3. According to the notice, SAMHSA says as of June of 2025, it has now exhausted the $33 million that Congress allocated for Option 3 in fiscal year 2024. It says Option 3 will have to be shut down because of that on July 17th. Now, that does not mean that the LGBTQ plus community can't get help. 988 will still be functioning. It will still be available after July 17th. And anyone in crisis, including LGBTQ plus youth, will still have access to skilled, caring, culturally competent crisis counselors who can help with suicidal, substance misuse, mental health crises, or any other kind of emotional distress. It's just that the tailored Option 3 won't be available anymore. Now, it's important for you to know that millions of Americans in crisis call 988 every year. This service is a critical lifeline for people. Since 988 first went live in 2022 to today, 988 has received more than 14.5 million crisis calls, and 1.3 million were specifically routed to Option 3 for LGBTQ plus youth. The Trevor Project, which is an LGBTQ plus advocacy group, called this move by the Trump administration devastating, especially for this high-risk group of young people. And it goes on to ask that Congress reconsider and add more funding for Option 3. It's also worth you noting that Option 3 isn't the only impact that we're probably going to start seeing when it comes to 988. That's because SAMHSA funding is most likely going to be cut dramatically by Congress in their budget bills. And when funding is cut, services get cut too. And on top of that, as I told you in this video back in March, Secretary Kennedy is in the process of cutting thousands of jobs and even agencies within the Health and Human Services Department. And SAMHSA is definitely part of those cuts. In a massive restructuring plan, Kennedy said that SAMHSA, along with 4 other agencies, would be rolled into one consolidated agency that he's calling the Administration for a Healthy America, or AHA. He says it's necessary to do that to cut down on bureaucracy. Look, if you are in crisis and you need help, please still contact 988. As I said, it is available 24/7, 365. It is free and confidential. And if you want to see more from SAMHSA or from the Trevor Project, I'm going to email all of that out to you in my Facts HQ email, so make sure you sign yourself up.